And this is what I want to share with you at the moment. And I'm also going to start. Okay, I'm going to start with the video. And for a moment, while you take a deep breath after this conversation, I would like to share this quote, because this is the spirit of a course like this. Edison said that the doctor of the future will give no medicine, but will interest his patients in the care of the human frame, in diet, and in the cause and prevention of disease. This is very relevant. The whole point is, especially at a time in history in which so much of the environment has been eroded as a result of many factors such as pollution, etc. It's very important to recapture diet and to restore diet as a very important factor in creating and recovering health. So please keep this in mind when you're studying for this course. I would also like you all to know that this assignment that you have, it's really a lot for you to have to read, especially if you don't have a science background, for the second article. And I think that at this point, given the circumstances of this year, I hope that I can, because I'm responding to what the administration requires me, reduce the assignment to just commenting on the fire within that deals with inflammation. That is a very simple, quick read. And you can then state your opinions about that and save yourselves more reading and have more time to focus on the exam. But for that, the assignment will have to be reposted. So if you don't want to waste any time, start reading, and it's a one-page read, the article, The Fire Within, and that simplifies the assignment.
May I make a suggestion?
Yes, please.
This is Chiara.
Yes, Chiara.
To me, I think reading the papers, I like reading the papers. If we could just, instead of writing the paper, a one-page paper, just simply answer your questions that you're asking. Like this, you don't need to change anything. We don't have to, we just answer the questions instead of actually writing the whole paper.
So what you mean, Chiara, is the questions that I wrote as guidelines for you?
Exactly, just answer those questions.
Yes, fine.
Instead of writing a paper.
Yeah, with me, it's fine. If it's fine with the administration, it's absolutely fine with me.
Wonderful. I think that would already, for me, be a big help.
Yes, and then it's fine, because you can do speed reading of the longer article, and that way it can stay the way it is, and it really is for your own learning and for your own awareness when you work with your patients. You know, as you transition, is anybody here in Louisiana or any of the states with prescription authority? Okay, nobody is. In prior years, there were usually a couple of people from Louisiana or other states. And you see, when you begin to practice and can use somatic therapies, your role as a psychologist is enhanced and enriched, but you also have a lot more responsibility. And that is something that Dr. Rush Newman is one of the people that wrote about that several years ago. These are the pioneers of the prescription movement, and it really is my generation. And I have experienced that in New Mexico, and even in Washington, D.C., or in California, where there are no prescription privileges. If you can begin to use methods of somatic therapies, it really expands your background. But for that, you need to have certain kinds of information. So we have agreed that instead of putting together a paper and having to edit it, brief, well-thought answer to each of the questions will be fine. And those papers are not going to be graded at all. It's just a matter of doing them. And
what were the 3 questions, Dr. Gall? This is Geraldine Datz. I'm sorry, I might have.
No, there are questions in when I wrote the assignment, and believe me, this was something that was assigned to me in the last minute that I was not even aware of. When I wrote the assignment, I wrote several questions to guide you in writing the paper. But Chiara suggested, instead of writing the paper, to write each question and then write a 1-sentence answer. If you want to write a 3-sentence answer, it's up to you. But so long as the answer makes sense, it's fine. It's up to you. Is it clear to everybody?
And those questions, I guess I just didn't see them. I'm looking right now on Moodle. I see the papers, I see the slides, and I see the links.
There are no slides. There are no slides. Because
so there's a Word file. If you can look, there's a Word file that says assignment for introduction to molecular blah, 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 blah.
Ah, okay.
And then there's
yes.
2 papers and then a few questions underneath.
Okay, thank you.
Yeah. Make it as easy as you can for yourself.
Thank you.
Yeah, you're welcome. And so now we're going to review, which for some people is going to be like going through a workout and not paying attention what streets you're crossing. So now we're going to pause on the slides that are the most important ones for you. We're emphasizing what's going to be on the exam, but also what are the most important concepts for you to have. And we're going to make it very simple. Of course, you need to be aware that many of the health conditions that we're seeing, so many today, have to do with poor nutrition and metabolism. And one of the reasons that after starting out as a psychologist and a neuroscientist, I studied naturopathy, nutrition, and so on, is because the first decade of my practice, I did not see on, and people were getting sicker and sicker physically. And because of changes in the practice of primary care, physicians were spending less and less time with them. And because they felt comfortable talking to me as their psychologist, they started telling me more and more about their physical problems, which that would be another course. In the psychosomatic model also, we interrelate the physical expressions to what's happening subjectively. But the point is that it was more and more important to know how the mind and the body interacted. And diet and nutrition are crucial. It's not a question of popping supplements, it's a question of eating the right things and digesting them well. So I'm not going to ask you about any of these states, but I would like you to be aware of the major biomolecules. You have nucleic acids, lipids, carbohydrates, proteins, and inorganics. Then, if you have any questions, please ask me, and then I'm going to ask you questions.
Has this document been uploaded, Dr. Gall? This is Geraldine Datz.
What
or
document?
Do you just have this? The
what
one that's on the screen.
Oh, you don't have it? You're not seeing it?
No, I am seeing it. I'm just not seeing it in the copies of my slides.
This is part of this is your slides. We're going over the slides.
Oh, okay.
Yeah, this is stuff that you've already seen. I'm not introducing anything new.
Okay, thank you.
So now,
I have a content question actually.
Yes.
This is Chiara.
Yes.
I was wondering, you only short, like very on the last slide or something, you mentioned fasting. So you're talking a lot about what to eat, but what about when to eat or what not to eat? You know, like
that is a very important question. Yeah, very important question. What to eat and when to eat. What to eat is really biochemical and psychological individuality. It depends on what you need. The most general guideline that I can give you is to recommend, in general lines, the Mediterranean diet. Now,
I'm sorry, that's not what I meant. What I meant is, are you ever leading your patients through fasting? Because sometimes then it depends on what people want to work on, but reducing the time in which they eat, reducing the window will give the digestive system a rest also. And the research shows that that has been another kind of access to, you know, helping people eat healthier in the end. So I'm just wondering if you ever use it in your practice.
Modified fast, because otherwise it needs very careful monitoring, and it's best done in a spa or in a place where people can do it well. But there can be, and some people do it in my practice, a 12-hour fast is already something important, because they are repair mechanisms that get activated. And, you know, without getting much into the science, what it activates is a phenomenon called autophagy.
Yeah, but not after 12 hours. You need to fast longer than that.
You need to fast longer than 12 hours. And for that, it really needs very careful monitoring. So if you are planning to suggest to somebody a fast, you need to have, especially not having prescriptive authority, and especially you need to be associated with a primary care provider that can supervise that person, and you need to do a pre-fast exam of cardiovascular function, etc., and some labs in order to make it a safe process.
Thank you. But my question is, do you do it in your practice? Have you ever done it?
I just answered the question. A modified fast, which is 12 hours, but I do not do in my practice a supervision of people fasting day after day, unless there is collaboration with a primary care provider.
Somebody, okay, I understand.
Yeah.
Thank you.
And you have the major biofuels here, and then this is a very important slide, ATP. Do you all remember, whoever wants to answer this question, or if you all want to answer it, what are the two organs in the body that have the highest energy requirements? Exactly. So this is a fundamental notion. And what are the two substances that the brain runs on that are very, very crucial for the brain? Yes, Abdullah, very good. One is glucose. The other one is? Oxygen, Mateo, very good. Yeah, okay. So glucose and oxygen, very important metabolic aspects. And then the vagus nerve, very important for the communication between the brain and the heart. Vagus nerve. Do you all remember from your neuroanatomy what type of nerve it is? Sympathetic or parasympathetic? Parasympathetic, very good. Okay. Okay, now this is an important slide because these are very major topics in current medicine, especially in functional medicine. And I cannot overemphasize the importance of epigenetics. This is good news for us who are psychologists, because 92% of our health depends on epigenetic factors, not the genes themselves, but the lifestyle factors that are modifying the program's expression. And there is a geneticist from the NIH who was in charge of the Genome Project, who concluded that if you spend more than $100,000 on genetic tests to determine your risk to develop diabetes, you get an accuracy of probability of 80%. And if you do that without genetic testing, it's about 7.5%. So the point that he made at the end of all that work on the genome was that putting your money on the epigenetics really has the furthest reaching results. And factors like inflammation, mitochondrial function has to do with energy generation. So cardiovascular function, brain function will have to do with mitochondria. Digestive system functioning too, but primarily the brain and the heart functioning. Methylation. Methylation is the modulation of gene expression, silencing some genes that are bad genes and allowing some of the good genes to manifest. So this is an important slide. Then these predictive biomarkers, have you all done your lab testing course? Or you haven't yet? No, they have not. Okay. Tell me if you're not familiar with these analytes, but you can do this in blood, except for the first urine that I have mentioned. And one is hemoglobin A1C. And this is the longer term control of sugar. This is sugar within the last month. It's like how well your body, it reflects how well you have controlled modulated sugar in your body in the last month. It's a better predictor than glucose alone, because you could go and have your blood checked and you could come out with a glucose that's higher because you had a very acute stressor, or you didn't sleep well at night, or you were exhausted, etc. And then you could come out at after 1 month with a much better hemoglobin A1C. And then homocysteine. depends also on good methylation. It depends on good levels of B12 and folic acid. And then high sensitivity C-reactive protein. That's very important. Very important because it has to do with inflammation, systemic inflammation and repair ability in your system. And this is sugar regulation within the last month, Abdullah. And oxidized LDL, HDL, and 8-oxoguanine. It's a measure of oxidative stress. If you have too much oxidation, you have free radical formation, and you have deterioration, erosion, and more risk for inflammatory conditions, degenerative conditions, etc. I was asked to repeat high sensitivity CRP, high sensitivity C-reactive protein. Usually the physicians will do the C-reactive protein, but high sensitivity is a much more sensitive measure if you can do that. It's a measure of inflammation overall in the body. For example, a patient that has just dental problems could have high levels of HSCRP just from some inflammation in the gums or dental infections. So be aware of that too. Dental oral health significantly affects total health and is a reflection of it. And then vitamin D3 is a very important neurosteroid and is instrumental in cell talk, adhesion, and it's recommended that you have an optimum level of vitamin D because of its many, many metabolic influences. If you have enough vitamin D3, then the vitamin D3 will be able to direct the calcium to go into the bones. So you're going to have better bone renewal. You're going to stimulate the osteoblasts that are the cells that are responsible for bone repair. The 1pm urine pH, is the one that looks at the risk for acidosis. And if you have acidosis, then you're going to be having more risk for metabolic illnesses and more risk for degenerative illnesses. Buffering minerals are alkalinizing minerals such as potassium, magnesium, zinc, etc. And lastly, it's very important to do hypersensitivity tests. This is a particular test that looks at your lymphocyte reactions to being exposed to different foods and environmental factors, because if you are sensitive and you're exposed to those foods and environmental factors, they cause a burden in your immune system. Now, as of the last, I would say, 6 years or 5 years, the publications came in 2015 or so. It was established that the immune system of the nervous system is not independent of the rest of the body, that there are some structures called lymphatics, whereby the immune system of the brain communicates with the rest of the body. This is the reason that I'm pausing and I'm asking you to be aware of the importance of the immune system for brain-mind interactions. And I'm going to double check on the length. There is another measure for 3 months. There is a measure, the glucose is the immediate measure. There is a measure at 1 month, and there's a measure for the last 3 months. And there are 3 different tests, and I'm going to check that at the break. Then we have drug effects on mitochondrial functioning, and we have seen how some of the benzodiazepines, some of the tricyclics, and some of the traditional antipsychotics inhibit CoQ10, deplete CoQ10, and therefore you're going to see more tiredness, fatigue, and mental dulling. This is important for you to know about this basic chemical reaction, but I'm not going to be asking you about this specifically. It's very important for you to know about what the 4 basic nutrients are. Carbohydrates, proteins, fats, and water. It's important for you to know the difference between the RDA and the ODA. And also it's important for you to know which ones are the water-soluble vitamins and the fat-soluble vitamins. Now, this symptoms of nutritional deficiency, what you need to know about this slide is just that B complex is crucial for mental health. That vitamin C is crucial for adrenal function, and it's a cofactor in one of the catecholamine formation. And magnesium, obviously we've emphasized very many functions of magnesium. And as far as iron and zinc, they are important in the metabolization of drugs, because they are part of the, especially iron, part of the cytochrome P450 enzymes. Selenium is important in terms of thyroid functioning. CoQ in terms of energy, and it has been linked, deficiency of CoQ has been linked to depression. Carnitine primarily, I would say, for energy metabolism, for burning fat to generate energy. It's important also, and you've already been quizzed on that, to know the major causes of inflammation. And make sure you remember this, because any of these causes of inflammation can also result in behavioral effects, mental and behavioral effects. When you have an acute infection, you're feeling tired, you withdraw, you cannot sleep well, and the same thing could happen when you have an injury. Stress, emotion, and diet are more obvious factors of inflammation.
Dr. Gall?
Yes?
Geraldine Betts. The 5 major causes, so I'm counting injury and infection, of course, is number 1 and the most prevalent.
It's number 1 and 2. It's number 1 and 2.
Okay, and then diet is 3rd, depression is 4th, and what
No, depression is not a cause of inflammation. No, it's all the way around. It's, let me go back to this slide so that it becomes clear here. Let's see how I can go back to this.
Oh, I see. They're all on that slide.
Let me see. You see, 1 is injury, 2 infection, 3 stress, 4 emotion, 5 diet.
Thank you.
This is also important, because you could be very helpful to your patients in recommending B complex. And there are different kinds of B complex out there that emphasize in the formula one or another B vitamin. I usually like to have a more balanced B complex. I'm not going to ask you for details about this, but these have very, very important ramifications for your mental functioning. But just take a look at this slide. Now, it's important for you also to know amino acids are the substrates of neurotransmitter substances. If you are interested and you ever have the chance after you take your tests, at one point it was considered that neurotransmitters were the basis for certain kinds of mental states and behaviors. But as research deepened into the importance of energy generation, mitochondrial health became much more of a fundamental factor. And the trend was to consider more that rather than thinking of neurotransmitters as the causes of deficiencies, as the causes of depression, such as in the monoamine theories of depression, it was thought that it requires energy to make up neurotransmitters. It requires a metabolic process. So the underlying mitochondrial issues may result in compromising neurotransmitter productions. And not only the underlying mitochondrial issues, even if there were not issues on that level, deficiencies of amino acids could be responsible for the neurotransmitter deficiencies. And for example, there is another one. You could do an amino acid panel that only takes the essential amino acids, and somebody could have a very good level of phenylalanine. However, if you also test for the derived amino acids, and you find tyrosine, for example, you could find that there is a deficiency of tyrosine. Why? Because the enzymes that convert from phenylalanine to tyrosine are not working properly. Or you could find good levels of tyrosine, but then you could find an impaired level of neurotransmitter because the enzymes down the line do not work better, which leads to metabolic processes, digestive processes that are responsible for the enzymatic reactions in which these substrates are converted to neurotransmitters. And this is something that you have already studied in biochemistry, and this is something that you need to know as the basis for your understanding of the different kinds of drugs that you eventually may be prescribing. What comes from what? And which ones are excitatory and which ones are inhibitory. Now, tryptophan can be either inhibitory or it can also be excitatory. For example, there are some of the SSRIs that have as a side effect insomnia. Some people who take Prozac cannot sleep well. And you need to remember also that in serotonin, there are very many different subtypes of 5-HT, different subtypes of serotonin that fulfill different functions. And now taurine. This is a very important amino acid, and it's one without side effects. It's very important for many body systems and many functions. I have already asked you in the quiz. Most people responded correctly. And it's even important for memory because it promotes neurogenesis in the hippocampus. And the primary organs that it benefits are the brain, the heart, and the gallbladder. Now, at this point, we're going to take a 5-minute break. And when we get back, we're going to continue, and there will be time for questions and answers. Glutathione. So, glutathione. Oh, and thank you for the reference about the slide, Arnold. Thank you very much. Now that the hemoglobin A1C has been clarified, and that is a very, very important measure of long-term regulation of blood sugar, based on hemoglobin and not on a protein. That's why fructosamine is a protein. Glutathione is a very important. If I asked you, what is the most important thing that you can tell me about glutathione, what would you say? And this is a question for everybody. Oh, the audio is in and out. Can you all hear me now?
I can hear you, Doctor.
Sounds good here.
Okay, good, good. Okay, so why is glutathione so important for mental health? Anybody can answer, please. If you use the audio, identify yourself. Yes. Detoxifier and antioxidant. Now, from what you learned in anatomy, especially in the digestive system and the brain, your anatomy, why is it important to have a good detoxifier? What is the major detoxifying organ in the digestive system? What is the major organ of, yes, exactly, great. Very good, Chiara. Very good, everybody. So, the liver detoxifies. In the liver, there is a vein. That vein is the portal vein. Where does that vein go to that is relevant for our profession? The portal vein goes from the liver. Important not for drugs alone. No, it goes for, where does the portal vein go? It goes to the brain, and it will carry with it whatever has not been properly detoxified in the liver. And therefore, it's going to affect brain function and therefore mental function. So this is why the detoxifying functions of the glutathione are so important, and the antioxidant functions are very good. So as you mentioned, Chiara, decreasing inflammation will be a function of antioxidant activity. Okay, very good. And the portal vein transports substances from the liver to the brain. Okay, so let's move on. Oxidation and glutathione, we've already seen this. And there are ways in which you can, if I asked you, it's really in the title of the slide, how would you increase glutathione? Through diet, nutrition, and exercise. You would also increase that through proper stress reduction, but primarily diet, nutrition, and exercise. The functions of the different amino acids are very important for you to know in general. Yes, to clarify about the portal vein, there are several pathways and it ends up in the brain affecting whatever happens in the liver. So there is several steps of connection between what's happening in the liver and what's happening in the brain. The point I'm trying to make is that it's not independent yet. All the organs in the body are interconnected, but if there is very high toxicity in the liver, it's eventually going to affect all body systems, because the circulatory system happens all over the body and eventually goes to the brain. And this amino acid summary is something to know in general, not with much detail. This for your own information, but you're not going to be testing on this detail. And if I asked you, what happens if you have an unsaturated fat versus a saturated fat? The unsaturated fat leaves free spaces, and those free spaces are more vulnerable to oxidation. In the saturated fats, there is no more room. Now, when they pumped hydrogens in the polyunsaturated, in the vegetable oils, to make them saturated to prevent oxidations, they did not create healthier fats. They just created processed fats, which are not healthy. This is why, in general, if you're going to cook with oils, first of all, it's best not to fry foods. But if you're going to saute foods at all, it's best to use pure butter or pure ghee or coconut oil, although some people are debating that. It's not a good idea to use even the best of the olive oils, or because the heat will start the oxidation of the oil. Grapeseed oil, for example, had its own antioxidants, but it's a polyunsaturated fat, and therefore you can use it, but very, very moderately. It's best to steam your foods or stew your foods. And one important concept in this slide is that the fats make 50 to 60% of structural brain matter, and that the brain does not use the fatty acids. But it needs the fatty acids for membranes, for building the neuronal and glial cell membranes. Yes, Jason, you're saying that nothing crisps the chicken like Crisco. But if I begin to tell you what happens in your body when you take Crisco, you may change your mind about using it. So this is like enjoy now, pay later. And you need to know what phospholipids are. This is something that you have already studied. Just know what a phospholipid is. Vitamin C is extremely important because it's the universal antioxidant and it recycles many other substances and regenerates and repairs. So that's all you need to know about vitamin C. Vitamin D, what would you say to a patient taking vitamin D2 rather than D3? Why do you want them to get D3? I'm going to answer that for you, because if you get D2, yeah, very good, Danielle, because otherwise you need, very good, Danielle, you need to convert from D2 and D3, which, you see, the metabolization of vitamin D also depends on good kidney function and good small intestine function. And so, unless the person is in very good health, they may not properly be converting. So why bother with that extra step? And it is relevant to psychopathology. And then this is one of the biomarkers that is very important to have checked in your patients. And there are different ranges, but usually a range of 50 to 80 in a blood sample is a very good range. For so-so health, more than 30, but usually I don't like to see levels of vitamin C optimally 60 to 80, but no less than 50. And what about coenzyme Q10? What do you all associate coenzyme Q10 with? This vitamin that we call CoQ10 or ubiquinone. Exactly, everybody got it. And why do you associate it with statins, Jason? Very good, everybody. Yes, you will recommend it for somebody who is in a traditional antipsychotic. Yeah, but it's, don't take my say-so. A couple of colleagues have corrected me on something that I had mixed up with another lab test. So don't take my say-so. Everything with a reason. Statin drugs block a pathway. You see, when you block the enzyme that blocks the formation of cholesterol, also blocks a metabolic pathway that makes up CoQ10. And because of that, when you have, when you are taking statin drugs, it's an excellent idea to supplement with CoQ10. Several cardiologists have been doing this for years now, and I understand some of the statins in the market are coming with CoQ10. So I hope, Jason, that now it makes sense to you. Alkaline cells, very, very important. Alkaline cells healthy, acidic cells are unhealthy. Iodine. Iodine, just the connection with thyroid function. That's all you need to know. And cognitive deficits in children from iodine deficient mothers. That's all you need to know about this. No more than that. Selenium is very important because it's a major antioxidant trace element. That's all you need to know. And it's also part of the enzyme converting T4 to T3. One particular food that is high in selenium are shiitake mushrooms. Some of you may be familiar with it. Another one are Brazil nuts. Zinc. Now, I'd like you to have some idea about zinc because zinc is involved in more than 4,000 enzyme reactions. It's very important for protein synthesis, DNA synthesis, hormones. If you have a deficiency in zinc, you're going to have hormone problems for both men and women. For men's prostate function, it's extremely important. You are going to see the formula, the nutritional formula that are given for men with BPH, benign prostatic hypertrophy, that they all have a good measure of zinc. But it's also involved in neurotransmitter regulation and signaling. Then what you need to know about iron is that it's very important for transporting and storing oxygen. So, and that it's part of the cytochrome P450. So that's all you need to know about this. And does anybody remember what test you would order to get a good reading on the iron status? What lab test you would order? What test for the status? It's not statin. Status of iron. For whether you're iron deficient. Exactly. Yeah. Very good, Danielle. You would ask for TIBC, total iron binding capacity. It's bound to proteins. And then magnesium. Vital for health. It was called a few years ago the forgotten electrolyte, and now it's no longer forgotten because now in every magazine you're going to see magnesium is so important for your health. And if you work with kids, there is even on the market a formula, that a form of magnesium citrate in a powder that you can get at the health food store that kids can take in water, dissolved in water, to help them relax and go to sleep at night. Hmm? And something which is very commonly known is that when you are deficient in magnesium, you have muscle spasms. Now, what is the test when we want to test for magnesium? What is the best test that we use? What is the best way to test for magnesium? Do we do magnesium in the regular blood test? Do we look at magnesium in the red blood cells? RBC, very good, Maribel. And Maribel, why do we test RBC magnesium and not regular serum magnesium, not regular blood magnesium? It is because magnesium, you need to assess the magnesium that's active. It lives in the red blood cells. If you have a deficient level of magnesium in your red blood cells, it gives you the accurate status of the functional magnesium, the magnesium you can use. If you test the magnesium in the blood, you could have normal level of magnesium, but it doesn't get to the red blood cells. Now, if you also have deficient magnesium in the blood, as in the example I was telling you yesterday of that elderly man, then you're in really bad shape. And you're going to have many problems, from muscle spasms to constipation to problems with your heart, etc. RBC magnesium is more expensive, but it is the accurate way to measure magnesium. And now, the microbiome. If I ask you to name 2 psychobiotics, what would you say? Two types, name 2 psychobiotics. Name 2 psychobiotics. Yeah, very good, Maribel. Very good, Kirsten. Lactobacillus and bifidobacterium. And you know, these are very important, and I don't want to bring in too much more detail, but the important thing is that this lactobacilli and bacteria are responsible for making very important neurotransmitters like GABA and like serotonin and dopamine, etc. So those bacteria are very important factories of the neurotransmitters that help us maintain mental health. This is the gut-brain-mind connection. And this is why it's so important. So you never thought as psychologists you would be studying immunology, but that is extremely relevant with what we know today. And you have many different species. Yes. Let me finish with microbiome. I can't remember your name. It's G Dots. I'll tell you. These are neuroactive compounds from metabolites of the microbes in your gut. You don't need to remember this. You just need to know. Look at these microbes are making the lactobacillus and the bifidobacterium. They're making acetylcholine. They're making GABA, and they are modulating opioid and cannabinoid receptors in the gut epithelium, which means they have a lot to do with the modulation of pain. Geraldine, yes. And now I'm going to tell you, or can anybody else say again, what is the most accurate test for magnesium, for functional magnesium, the magnesium that your body utilizes to do its job? Best test for magnesium, yes. So you see now, Geraldine, it's RBC, red blood cell magnesium. Botanicals, you need to know the 3 classes of botanicals. So this is an important slide. And you need to be able to give a couple of examples of adaptogens. Your favorite. Whatever they are for you. You need to know what phosphatidylserine does. And now we're going to go all the way. Saffron, St. John's wort, and the curcumin. Saffron, St. John's wort, and curcumin. Add curcumin for their antidepressant effects. And they have done studies showing that. Among the detoxifiers, the only one at this point that I'd like you to remember is the milk thistle. Excellent liver support. And this is just for your information. Don't even bother with this. And see, these are adaptogens, not the echinacea. Echinacea is an immune modulator. But the other 4 have adaptogen effects. So ashwagandha, berberine, lavender, and turmeric. That's all you need to know. And CBD has powerful anti-inflammatory and anti-anxiety effects. But there's a problem with bioavailability with at least 70% of the products in the market. So be very careful. I'm not going to ask you details about this because you can look at this as a guide when you see your patients. What I do want you to remember is in slide 184, because you're going to see a lot of women on oral contraceptive, the nutrient depletions for the oral contraceptives. Look at all the B vitamins, all the B vitamins and zinc. Look at vitamin C. You know, this is why some of these women who are on oral contraceptives, when they come fatigued and so forth, you know, you need to ask about how long they have been taking the oral contraceptives, and if they are in a really good quality multivitamin in which they're getting the B complex and the minerals, etc. Now I'm going to pause for 5 minutes and we're going to have our last stretch. Make sure that everything is clear and that we were talking about detox. Detox is important because of general health, because of drug effects and the need to detoxify those. And that means that you have to have a very good digestive system. So there is not a big separation between your digestive system and the rest, and the rest of the other organs that, you know, you digest in your GI tract, small intestine, etc. And if something is not properly digested, and if toxins are produced, then those toxins go through the liver and the liver will detoxify. But many people, especially in this environment, do not have a very strong liver function. And there is a range from very, very mild issues resulting in headaches and so on to more major issues when those toxins that normally go through the liver for detoxification and then get eliminated through feces and urine or through sweat, those reach the blood. And then through the blood, those toxins reach the brain. And one extreme form of that is, you may have heard, that happened, I had the experience with one patient of a hepatic encephalopathy in which the patient was very confused and disoriented and very tired and so forth, in which they had been polypharmacies. This was a teenager who, in addition to having a psychotic episode, she got in the hands of several physicians who were adding one medication after the next. And there was one psychiatrist that started treating her also with antibiotics because she felt like this young woman had Lyme's disease because of some test done with a Western blot. And the young woman ended up in the hospital in the mental state that I just described. And after that, obviously, she was taken off all medications, and we started new, and we did very, very basic nutrition and psychotherapy and homeopathy, and she began to improve significantly. Now, herb-drug interactions, I'd want you to be aware of this one, but I'm not going to ask you about this in the exam. I think it's too detailed. And this is primarily for your knowledge. Methylation. Here we start on an important topic again. So everybody can hear me now?
Yes, doctor.
That's great. Okay. So methylation. Let's be clear about methylation. The major functions is to convert homocysteine, which is implicated in the risk for cardiovascular illness, back to methionine. It quiets DNA expression of bad genes, and it detoxes everyday chemicals. The best way to test for that is either blood or urine, not necessarily urine alone, but methylmalonate or methylmalonic acid and FeGlue. And I highly recommend the use of sublingual forms if you can get those. And you don't need to know about the details of these. There are strong links between B12 folate deficiency and mental disorders. I've given you examples from patients who improved dramatically after their B12 and folate were replenished. Now, you need to know also that B12 is formed in the human body. It's formed by the parietal cells in the stomach. And people who don't have good stomach function will be more vulnerable to being deficient. So what age group do you think is going to have, as a whole, more issues with B12? What age group? What age group do you think is going to have more issues with the older? Yeah, older, you know, after age 50, there are more issues with the production of hydrochloric acid, which is very important in stomach functioning. And this is why it's so important for older people to be tested for and to have good B complex. Good B complex is for everybody, but this B12, B6, B12, folate acid, and magnesium is extremely important. And then folate is very important. And it's very important for the modulation of serotonin, the conversion of tyrosine to dopamine, epinephrine, and epinephrine, and for the modulation of the opioid and the NMDA receptors. And it's usually a very good idea if your patients are on medication to have them take a good multivitamin in specific cases, a good B complex, and that way you're giving them a boost in their ability to metabolize those vitamins. And methylfolate is being used as an augmented strategy with antidepressants. And in my book as a nutritionist, I like to use a combination of forms of folic acid in order not to create an imbalance. But this is something which is very publicized and highly practiced in the area of psychopharmacology today. Magnesium with stimulants, that's another one. And you know, it's this one I'm going to ask you to take a look at, because you could use melatonin as an enhancer, and you're going to find with some children are given now melatonin who have sleep disorders, and I am personally not convinced it's a good idea, because they are at a very early age, and when you give a hormone, the receptors become a little bit less sensitive. And so I would rather use herbs or homeopathy, or I would use actually, I would teach them self-hypnosis or other methods once you find out what the source of the sleeplessness is. I would give them those other methods rather than melatonin. Melatonin I would use for people who are older, and with women of childbearing age. This is not on the slides, but this is a useful information for you to have. For women of childbearing age, it's not a very good idea to take melatonin, especially if they want to conceive, because it may be inhibiting some hormonal functions that are relevant to conception. And depletions from, as I asked you in the quiz, you all did very well on that. And I would like you to know about rhodiola, because it's one of the best adaptogens. I have used it in my practice with many patients who either don't want to take medication, or patients who want to taper off and get off antidepressant or anti-anxiety medication. And the results have been very good. And the doses, the patient response will tell you what doses they need, whether they need 2 capsules or 4 or 6 or 8. And I've given you examples depending on the individual, the level of stress, the type of problems, whether or not they're on medication, etc. This one is too technical. Haldol and lipoic acid is something that you may want to consider for the antioxidant effects. Gabapentin, I would just, this is an important one. The link between certain meds and hypothyroidism. And the reason I want you to know about that is because sometimes when a person comes and they say they are depressed, you have to look at both adrenal and thyroid function. Much of thyroid function today is secondary to adrenal stress. And therefore, it's important to assess both. And in some cases, it's a nutritional issue of a conversion. In another case, it's because they're taking meds. But when somebody comes in and they have symptoms of depression that are connected with even subclinical hypothyroidism, you have to look into levels of stress, adrenal exhaustion, burnout, etc. And you also have to look at possible endocrine disruptors. Nutrition and metabolic syndrome, we've already covered. And really, if you look at B complex and magnesium and omega-3, diet, fiber, and the elimination of certain aspects of the diet, all of that is very important. And then obesity and health. Let's see. You know, it's very interesting. We're talking here about nutrition, but the single most aspect that has been connected with the prevention of dementia in older people, in addition to diet factors, has been, what do you think has been? Sleep is a factor. But there is something else that from a cognitive point of view is extremely important. I'm going to say exercise. Yes, exercise, Kirsten. Very good. And the reason is because in exercise, you have to be aware of what you do, and you have to coordinate several functions. And so it's not just the diet, it's the exercise. And yes, Danielle, sleep is extremely important because it is restorative. But sleep is not enough. You've got to move. So it's eat, sleep, and move. And socialize, because socialization, good relationships are good stimulation that have beneficial affiliation, nurturance, all of them have very good health effects. The body composition and health risk, it's important for you to be aware. And you can calculate your patient's body mass index. You know, if you divide their weight in kilograms by the height in the metric system, or centimeters rather. Then, of course, slide 226, foods to avoid. You need to be very aware of this. Nutrition to repair intestinal permeability. And how would you define intestinal permeability or leaky gut? What happens in intestinal permeability or leaky gut? Because you're going to get a lot of people, children and adults, who have quote unquote leaky gut. This is a term that a lot of people know about nowadays. In leaky gut, has there been only, Danielle, that the holes in the lining of the gut make it possible for what to enter the bloodstream? The holes are making the space for what to get into the stream. Undigested, incompletely digested protein and toxins and so forth. Very good. So that's why it's important for you to know about leaky gut, but not the details of the slide. It's important for you to know what gluten systemic effects are. And I'm not going to ask you about the biochemistry of this or anything like that, but it's what gluten does to the body in those who are sensitive to it. What is the most important effect that we're looking for here as an effect of gluten in those who are sensitive? Inflammation, it's important, but what else are we looking for? Yes. Yeah, and you could be getting effects that are very important for us. What could you be getting from those gluten effects? You could be getting inflammation where? Not just in the gut, but in the brain as well. And I haven't talked about dairy, but one of the things that I have done, and I'm not going to test you on that, is that with some of the kids that have autistic spectrum disorders, and I'm not even going to get into the vaccines or anything like that, but just with what diet interventions I would do, I have found that when I take the history and I look at sensitivities, very good, Kara, what I do is not only reduce, but eliminate, not because vaccines are unrelated, I will not talk about them, but because it's a very complex topic. In my Association of Molecular Nutritionists, a whole scientific meeting is going to be devoted this year to vaccination and immunization and the various effects, mental and physical. It's a very, very huge topic, and it's too specialized for this course. Elimination, so it's the gluten-free, dairy-free, sugar-free. I saw a child last year that was diagnosed with an autistic spectrum disorder, and they had done very well for a few years. He was in a special school program, and all of a sudden he started to have meltdowns. They put him on risperidone, the typical antipsychotic, and he was not improving hardly. So a colleague who is a neuropsychologist referred for a consultation, And I did psychotherapy. I did some behavioral interventions that were very helpful because he was getting into some ritualistic, obsessive compulsive behaviors. And at the same time, I said to the mother, they were very compliant and sophisticated about diet, eliminate gluten, dairy, and sugar, because the crisis was so bad that this kid was unmanageable. Within a week or two, this child was back to normal, and we were able to get him off of the atypical antipsychotics. And then after that, we had to work on enhancing cognition because he had missed a lot from those months of meltdowns and so forth until they started to see me. And what would I do with anger? Well, you know, anger has to do with a lot of things. It has to do with the hyperactive amygdala. It has to do with an abusive family context, with bullying, being bullied. It has to do with a toxic liver. With anger, I would first find out the probable causes. And then I would do interventions on several fronts. Nutritional, homeopathy. With that teenager with bipolar disorder that I mentioned yesterday, I used nutrition with very good results, but it was only after I started classical homeopathic treatment that there was a 180-degree change. And I just recently, a few weeks ago, I had been consulting on another patient who had multiple diagnoses of ADHD and Tourette's and a lot of other things. And I intervened with a proper homeopathic remedy, in addition to have recommended nutrition and psychotherapy and so forth. I had the kid on homeopathy. He did very well. Then he was needing another potency of homeopathic remedy, and he was again stabilized within 24 to 48 hours. So what kind of nutritional changes do you do? It depends on what causes the anger. That's what I'm saying. You know, some people who are angry sometimes have a lot of fire in their constitution, and this is based on the Ayurvedic, the Indian system of psychology. And with people like that, I would have them eat more cooling foods, and I would have them completely eliminate hot foods, such as pepper and cayenne and the spices and so forth. But I would first of all find out what the cause of anger are. And in some people, many people that we see also, there are some legitimate causes of anger because of situations in life that they just cannot handle. So you have to be very careful to sort out the biopsychosocial aspects of anger. And I would use also a diet that's cooling foods, and you can look at those in Ayurvedic cookbooks. And you can also do, for example, the amino acid taurine is very stabilizing and very calming. This is why I emphasized it before. And let's see, sugar. I'd like you to know about the addictive potential in sugar. This slide, not the research or the experiments, just for your own information. And I'd like you to know about the sweeteners, these sweeteners. And not in detail, but which ones are good, which ones are bad. And be aware of alkaline acid balance. Make sure they are balanced. Now, Kiara, you're asking about, do you mean monk fruit? I am aware of monk fruit. Yes, monk fruit is a sweetener, is used as a sweetener. And for some people, it works very well instead of sugar. You have stevia, monk fruit, you have something from the rainforest in Peru, which is called yacon. You also have the lohan, which comes from the Orient. There are several fruits that have produced sweeteners that are relatively good. Another one which you can get in the United States, which is nice, you can get all of them in the United States, but this one is produced in the United States, which is rice syrup, organic rice syrup, and that is alkalinizing, and it all has to be used in very small quantities. Vegan diets, this is for your information. Okay. All of this, you need to know what something which is organic. There are different levels of organic, and only if it's 100% organic, it means that it's produced with organically produced materials. And this list is something to keep in mind when you recommend foods to your patients. Now, tips on diet and nutrition, yes, I'd like you to know. And then food sources of omega, just to know a few of the ones that are low mercury. I'm not going to ask you details about any of this. Gas-producing foods, you really need to be aware if your patients have gas, which ones would you use? And also some tips for diet and weight regulation. This is common sense. I'd just like you to know some of what you see on this slide. And foods to avoid, we've seen already. From diet and depression, the most dramatic thing you need to know is that antioxidants are most effective when they come from fruit, at least in late life depression. So if you're seeing, those of you who said that you were involved in geriatric work, make sure that your seniors have good sources of fresh vegetables and fruit. Diet and lifestyle, it's very common sense. I'm not even going to ask you because most of you already know that. And this slide is important, in which you see different diet options, you know, the Mediterranean, DASH, Paleolithic, FODMAP. Different people respond to different diets. With the Mediterranean, you can't go wrong. But you also need to know that you need to be aware of what each individual may be sensitive to. And it's not just a question of allergies from an immunological point of view that are detected with blood tests. It's also what foods they are, or even environmental smells, perfumes, or environmental substances like gasoline, they may be intolerant of. There's such a thing as intolerance, and there have been books written by immunologists about that, because you may not have any immune reactions as documented by those tests, but you may be intolerant. You may be getting watery eyes and stomach irritation or intestinal irritation when you're exposed to certain diets, and that's because you are intolerant. So you need to be aware of that, and you need to ask. A good interview is more than 50% in terms of guiding your treatment plan. But be aware of this slide. The mind at it, I'm not going to ask you about these. And you know, be aware then that some of the psychological expressions of neurotoxicity we may confuse with anxiety and depression. And you need to do good differentials. And some of these neuroprotective agents are some of the same as our adaptogens. I like very much gotucola, which is also called Centella asiatica. And this one is it's an anti-anxiety herb, which also impacts the GABA receptor, acts on GABA A receptor favorably. Just have an idea about neuroprotective nutrients. And glyphosate, it's important to be aware because those of you, especially those who work in rural populations, may see people who are more closely influenced from glyphosate exposure. Electromagnetic exposure, that is something where you really need to limit. Don't hold your cell phone to your ear. Just hold it at enough of a distance. And there are some chips that you can buy that protect you from electromagnetic exposure. And this obviously is a common sense approach in which you need to do a very comprehensive history and assessment, psychological, you know, biopsychosocial. When you do your practicum for prescription privileges and your 2-year, as I did in New Mexico, of residency, once you have your conditional assessments, you really need to know everything about the health of the person, every physical illness, every emotional, mental issue. You really need to know the full biopsychosocial profile of that person. And you need to do sensible lab assessment, not excessive, but sensible. And so this is just a slide to be aware of. This is not going to be a big effort for any of you. And the rest is, you know, I'd like to know if this review has been useful to you in terms of understanding the materials better and being prepared for a common sense test about it. So, any questions, comments? You're welcome, Kiara, and I appreciate all your contributions in class and everybody's attendance. You're welcome. It has been very challenging, not only for you, but with this new technology this year, it has been challenging for me too. And as we agreed for the assignment then, I heard that you don't mind doing the 2 articles, but that you're just going to do a 1-sentence response. And new sentence, 1-sentence response, if you want, minimum 1 sentence that makes sense. And you're going to use the questions. You're going to just answer questions about each of the 2 papers. And yeah, vaccines is a topic that I really cannot touch at this point because it would open a lot of other types of information. And yes, you can do things with diet and nutrition and supplementation to offset problems with vaccination effects, but this is just too much. Any more questions? Any more comments? And I hope that those of you who have never made nutritional recommendations in your practice, that with this course, you will have a basis to begin. I have got feedback from several of the students over the last 10 years that have started to incorporate nutrition into their practices, and that has enhanced the work that they have been doing. Who would like to have a last minute comment? You can do it with a microphone or with a message. Yes, I hope to have the study guide posted tomorrow, and the earlier the better. And that will give you a chance then to go over everything. And I repeat, the exam will be simpler than you think. Yes. So everybody enjoy your evening, and I wish you all the best on the assignments and on the exam. And I hope that you sort out all the challenges with the new way of doing the program. And if any of you has any questions that you would like answered, please, you know my email. I prefer that you use my personal email because as an adjunct faculty, I don't check the Alliant email all the time. I've checked it this time and I knew what happened with the attendance and so forth, and it's all going to be sorted out. With this, I wish you all good luck, and I hope that you will be able to get prescriptive authority in the next few years. Bye.